Today we're presenting an overview of the equine cardiovascular system and how it makes the horse such an incredible athlete. So what is the cardiovascular system? Basically, it's the transport of nutrients, waste, hormones, immune cells, and most notably, oxygen and carbon dioxide throughout the body. It's also a key factor in thermoregulation by the vasoconstriction and vasodilation of blood vessels. The cardiac system is composed of two different systems: the pulmonary circulatory system, where blood travels between the heart and the lungs, and the systemic circulatory system, where blood travels between the heart and tissue. To give a brief overview of heart anatomy, the heart consists of 4 chambers, 2 atria and 2 ventricles. The heart also consists of 4 valves: the atrioventricular valves, which include the tricuspid and the bicuspid valves, and the semilunar valves, which include the aortic and the pulmonary valves. The chordae tendineae function as the structural support of these valves. The internal muscle of the heart is called the myocardium, which is the muscle responsible for the contractile function of the cardiac pump. Surrounding the heart is the pericardium, which is a protective, fluid-filled sac to reduce the friction when contracting. A brief explanation as to what gas exchange is that it occurs between alveoli and capillaries, where oxygen moves from the lungs to the bloodstream, and at the same time, carbon dioxide passes from the blood to the lungs. There are 3 main components of blood. 55% is composed of plasma, which is the liquid component of blood containing water, hormones, immune cells, and blood clotting factors. Under 1% is white blood cells and platelets, where white blood cells are types of immune cells, and platelets are responsible for blood clotting factors. 44% of blood is composed of red blood cells, which is made in bone marrow and contains hemoglobin. A fun fact is that horses have 7 different blood types. To review the steps of blood flow in the circulatory system, deoxygenated blood moves through the superior and inferior vena cava to the right atrium, and then passes through the tricuspid valve to the right ventricle, and exits through the pulmonary valve to the pulmonary artery to be reoxygenated in the lungs. The newly oxygenated blood enters the heart from the pulmonary veins into the left atrium, which then passes through the bicuspid valve to the left ventricle and exits through the aortic valve into the aorta to be distributed to tissues and organs. The electrical conduction system controls the heartbeat, heart rate, and rhythm generated by autorhythmic pacemaker cells. The first step is where the sinoatrial node triggers self-excitation. The second step is where the action potentials propagate through the atria, resulting in atrial contraction. The third step is where the atrioventricular node is activated by the action potential and transmits electrical activity to the bundle of His and Purkinje fibers with small delay. The fourth and final step is where the electrical activity propagates through the ventricles, causing ventricular contraction. Electrocardiograms are important to measure the cardiac cycle. Electrodes are placed at different locations on the skin to read the progression of the electric current wave. There's 3 waves: the P wave, the QRS complex, and the T wave.
2 common cardiac problems that occur in horses are cardiac arrhythmias and cardiac murmurs. An arrhythmia is an abnormality in the consistency of the heart rate. An electrocardiogram can be used to diagnose arrhythmias. A cardiac murmur is an abnormal sound that originates from the heart valves. They are sometimes caused by congenital heart defects that can cause blood to flow incorrectly through the heart. Use of an echocardiogram is the only way to diagnose heart murmurs. Most murmurs are not caused by a significant abnormality and are functional. Resting heart rate for a horse is between 28 and 44 beats per minute. This can rise drastically during strenuous exercise, with the maximum being close to 240 beats per minute. A horse's blood pressure at rest is usually around 120/70, but it can rise to around 250/120 during strenuous exercise. A horse's capillary refill time should be between 1.5 and 2.5 seconds. If a horse is healthy and well hydrated, their PCV should be within around 40%. There is no question that horses are extremely impressive athletes. Their extraordinary aerobic capacity during exercise is one of the reasons for this. Horses can take up oxygen up to 35 times faster during exercise than at rest. Horses have a VO2 max of 4 at rest versus 140 during high-intensity exercise. This massive increase in aerobic capacity during exercise is a key factor in the horse's superior performance as an athlete. A horse's athletic ability also increases greatly with training. Another factor that contributes to the athleticism of horses is the sheer size of their hearts. A horse's heart is usually about 7 pounds, which is around 1% of their body weight. A horse's heart can increase in size up to 30% after 16 weeks of training. Some of the most successful racehorses have been found to have the largest hearts of all. Famous racehorse Farlap's heart weighed 14 pounds, and Secretariat's heart weighed a whopping 22 pounds. One organ the heart works in tandem with is the spleen. The heart and the spleen work together to form the circulatory system and control the wildly fluctuating aerobic capacity of the horse. As blood travels through the spleen, damaged or diseased white and red blood cells are removed from circulation. The spleen is largest when the horse is at rest. During this time, it can hold up to 30 liters of blood. When the horse is stressed or excited, like in anticipation of exercise, the spleen contracts and forces up to 25 liters of blood out into the circulatory system. This influx of red blood cells allows for tremendous amounts of oxygen to be taken up by the horse's muscles, improving aerobic capacity within seconds. The lymphatic system is a system of vessels and nodes that perform the function of transporting lymph throughout the body. This system follows the veins of the circulatory system closely, eventually discharging into the thoracic duct. It is closely linked to most other systems in horses in a way that it is not in humans. Because it does not have its own pressure, it relies on the movement of other systems in the body to transport lymph. The GI tract plays a role in this. There must always be feedstuff in the horse's GI tract to aid in the contractions that the lymphatic system relies on. It is also true that the horse must stay moving in order to keep lymph properly circulating through the body. A common lymphatic condition horses can contract is called lymphangitis. Lymphangitis is the inflammation of the lymphatic vessels. It usually presents in one leg, most commonly a hind leg, and is often caused by a bacterial infection. It is extremely painful and can lead to long-term problems and lameness. Horses have a special feature to allow for blood circulation in their limbs. Because there are no muscles in the lower leg or hoof to aid in the return of venous blood to the heart, the hoof aids in circulation by acting as a pump. Constant movement of the horse allows for compression of the frog and digital cushion. This creates pressure in the veins of the lower limb, successfully pumping the blood up the leg and allowing it to return to the heart. This mechanism allows for lymphatic drainage in the leg to avoid the limb from stocking up. This is because the lymphatic system works closely in relation to the circulatory system's fluids levels. Plants that are dangerous to horses by affecting heart function are known as cardiotoxic. Cardiotoxic plants can be fatal, and there is no known treatment for them once ingested. Certain plants contain cardiac glycosides, which cause symptoms like those of a heart attack. Cardiac glycosides include lily of the valley, oleander, hellebore, laurel, azalea, rhododendron, foxglove, and hemp dogbane. Cardenolides, found in some milkweeds, cause cardiac arrest. Taxine, a poisonous element that inhibits heart function, is found in yew. Avocado leaves, fruit, and bark contain a cardiotoxin known as persin.
We hope you learned something new about the equine cardiovascular system. Thanks for watching.